Okay, let's talk about something a lot of us are guilty of. You know, that nagging cough that just decides to move in and won't go away? You know the one I'm talking about, right? You've tried tea, maybe some over the counter stuff, you've tried just waiting it out, but it's still there. So, the big question we're diving into is what if it's not just a cough? What if it's your body trying to send you a serious warning? So, we're going to break down the key warning signs, the things that take a simple cough and turn it into something that you really need to get checked out. This isn't just about one symptom, it's about seeing the whole pattern. This is the big one, the first major red flag. I mean, a cough from a regular cold or flu, it usually goes away, right? But if you're still coughing after 2 full weeks, that's your signal. That's when you got to stop waiting and start paying real close attention. Now, this is where you connect the dots. It's not just the cough, it's the cough plus these other things. Are you getting a fever that seems to spike at night? Waking up completely drenched in sweat? Losing weight when you're not even trying to? And coughing up even a tiny bit of blood is a huge, huge warning sign. If you're sitting there nodding along to a few of these, then you're in the right place. So, what on earth could be causing this whole cluster of symptoms? Well, the condition we're going to unmask right now is tuberculosis, or as most of us know it, TB. So what is TB really? It's an infectious disease and it's caused by a particular kind of bacteria. And here's the key part. It spreads through the air. This is exactly why that cough is so important. It's how the bacteria gets from one person to another. This image shows you where the infection usually sets up shop, right in the lungs. That's what's known as pulmonary TB, and it's the most common type. But it's really important to know that TB isn't just a lung disease. It can actually pop up in other parts of the body too. Now, to really understand why this is such a big deal, we have to look at the global picture. The World Health Organization says that TB is one of the top 10 causes of death on the entire planet. Just let that sink in for a second. It's the deadliest single infectious agent out there, even ranking above HIV/AIDS. This is not some disease from the history books. It's a very real, very current global health threat. Okay, I know that all sounds pretty heavy, but here's the most important part of this whole thing. There's a clear path forward. So if you think something might be wrong, what happens next? Let's take the mystery out of getting a diagnosis. A solid diagnosis really stands on these three pillars. First, the doctor's going to talk to you about your symptoms and your history. That's the clinical presentation. Second, they'll want to see what's going on inside with an X-ray. And third, they'll run tests to look for the actual bacteria. It's a thorough process, and that's a good thing. And speaking of that radiographic evidence, here's a real chest X-ray from a patient with TB. You see those areas the yellow arrows are pointing to? That's the stuff doctors are looking for, evidence of the disease right there in the lung. It's a key piece of the puzzle. To get that final confirmation, doctors have a few really reliable tests. A sputum test, which is basically just checking the phlegm you cough up, is super common. They might also use a blood test, a chest X-ray like we just saw, or even a simple skin test. None of these are a big deal, but they are incredibly good at finding out what's going on. All right, we've gone through the signs and the diagnosis. Now for the payoff. Why taking action on this stuff isn't just a good idea, it's a potential lifesaver. And why there is so much reason for hope. This right here puts everything into perspective. On one side, you have this staggering fact. About a quarter of the entire world's population is infected with TB bacteria. That's the threat. But look at the right side, and this is the message I really want you to take home. TB is curable and preventable. This is not a life sentence. And here is the proof, straight from the World Health Organization. About 85% of people who get sick can be successfully treated, usually with a standard 6-month drug regimen. That means getting better isn't a long shot. It's the most likely outcome if you get help. So let's be crystal clear about what you should do. First and foremost, do not ignore the symptoms we've been talking about. Your next step is to visit a hospital or health center. Ask to get a sputum test done. And please do not try to fix this yourself or just put it off. Delay is the enemy here. And all of this brings us to our final, most powerful takeaway. With tuberculosis, early treatment equals a complete cure. It's that simple. Taking action early doesn't just protect you, it protects your family and everyone around you. So the question is, what are you going to do about that cough you can't kick?